What's really wrong with you? Is your back, neck, or shoulders killing you? Is the pain dragging on for weeks, months, even years? Did you think that drugs, exercise, or a massage would take care of it? But it didn't. Has your doctor even suggested surgery as the solution? What you're about to see over the next 3 minutes may surprise you, but it's true. What's really wrong with you is that you have a hard spastic muscle causing your pain. That's right, a hard muscle spasm. Here's how muscles work. The amount of contraction a muscle has when at rest is called muscle tone. This is what a healthy muscle should look like when at rest. Soft, like a marshmallow. If it's not soft like this, it will eventually cause a lot of painful problems, depending on how hard it gets. Here's why. In between your muscles are nerves, blood vessels, and stuff like that. Things are pretty good in there when your muscles are soft as they should be. But if they become spastic and hard, the nerves and vessels get squeezed. And this is bad, because your muscles and everything else in your body need a good blood and nerve supply to stay healthy and pain-free. So how do muscles get hard and tight in the first place? Good question. Inside every muscle are millions of tiny nerves that are constantly sending signals to your brain every millisecond. As a muscle contracts, it produces lactic acid. If a muscle is overworked, used, exercised, or injured, lactic acid builds up in the muscle faster than it can get rid of it. This weakens the signal of these tiny nerves that connect to the brain, and with the signal weakened, the brain now mistakenly thinks the muscle doesn't have enough tone. So what does the brain do? It sends the command for more tone down to the muscle. As the muscle contracts more to increase tone, it gets a little tighter and harder. Lactic acid builds up more, which leads to more tone and hardness. You probably won't notice this all going on at first, but little by little, activities that overuse your muscles will ratchet up tone over weeks, months, and years, and eventually, you'll have muscles hard and tight enough to put pressure on nerves and vessels, causing the kind of pain that just won't let up. This is what you call the hard muscle spasm. And you thought that exercise, drugs, or stretching would get it right for you. Well, it actually made it worse. Here's where NeuroSoma therapy comes in. The only way to make a muscle soft and healthy again is by strengthening the signal of these tiny nerves to the brain. This is exactly what NeuroSoma does. By stimulating hard and spastic muscles the NeuroSoma way, the weak muscle signal is strengthened, and the brain now correctly recognizes that the muscle has too much tone. The brain has no other choice but to send down a new command for less tone. This causes the muscle to become softer and more relaxed. As this happens, the pressure on the nerves, vessels, and joints is reduced. And with less pressure, you're going to feel a lot better in a lasting way. Simply put, hard, tight muscles equal pressure, limited mobility, and pain. And soft muscles equal pain-free living. So if your back, hip, leg, or knee is killing you, or you have a nagging headache, neck, or shoulder pain, and you're just plain tired of it all, think NeuroSoma, the real solution for feeling good again.